Good morning. Welcome to all of our citizens who are on the air with us today. I'm today the one to kind of introduce our group and start the meeting for our chairman, who is not able to be with us today. And I'm always proud to be a part of Team Liberty. And today I feel like I'm the leader because I'm having to introduce it. So that's a real privilege. Donald pretty much serves in that position, and we appreciate him doing that. So I'll give you my little Hinesville report, and then we'll move forward from there. So since the beginning of COVID-19, since the pandemic began, Liberty County has had now 2,947 cases confirmed, and that has led to 54, it's horrible to say, 54 deaths. Governor Brian Kemp's public health emergency orders are still in place, and we should all continue following the CDC guidelines. The Diversity Health Center is conducting COVID-19 tests as usual by appointment 3 days a week at their offices located at 303 Fraser Drive. More information about COVID-19 testing can be found at diversity.org, or you can call 912-255-5575 and get the information you need. In the past 2 weeks, the eligibility requirements to receive COVID-19 vaccination has greatly expanded. On March 8th, educators and school staff, along with adults with intellectual developments and developmental disabilities and their caregivers, were added to the eligibility list. And this past Monday, March 15th, adults age 55 and over, along with individuals age 16 and over with certain medical conditions, were added to the eligibility list. So more and more people are getting them. Gosh, it appears that it's a great thing. A lot of people are getting these shots now. I've had mine, and I'll tell you, it won't work perfectly for everybody, but mine was a perfect experience with almost no effects whatsoever. With eligibility requirements continuing to expand, we highly recommend that you visit the Georgia Department of Health's webpage. There you can learn more about eligibility and schedule your vaccination if you want to. The webpage is covid19.gachd.org. And the latest public health emergency orders mentioned earlier are still in place and set to expire on Tuesday, April 6th in 2021 at 11:59 p.m. State and local emergency orders can be found at Georgia, georgia.gov. So in closing, I'll remind you again to wear your mask, wash your hands, and watch your distance. Hopefully things are going to continue to improve. We thank you for being a conscientious group of citizens in our community, and we hope things will continue to maybe even open up over the next several weeks. Thank you very much, and I'll turn it over to Mayor Larry Baker from Walterville.
Thank you, Mr. Mayor. To Team Liberty, Mayor Brown, citizens of Walterville, I'd like to say hello to each of you. This morning, I have some company with me, our interim chief, Al Hagins, and he wished well wishes to you all also. We come a long way, but yet we still got a long way to go. We can't give up now. Citizens of Walterville, let us continue to wash our hands, wear our masks, and our social distance. I have received my shot, and I encourage you to take your shot. I received both of my shots. So please, ma'am, please, sir, like Mayor Brown said, that we should open soon, but we don't know exactly how soon. So as we continue on to move forward, and remember, be caution, be safe, everyone. At this time, I yield to City Manager, Mr. Kenny Howard.
Good morning, Liberty Countyans. Thank you, Mayor Baker.
Yes, sir.
And as Mayor Baker and Mayor Allen Brown stated earlier, it is so very important that we adhere to the social distancing guidelines. I would like to just make a few points as it relates to the numbers that Mayor Allen Brown presented earlier. And that is, from the beginning of this last year, we in the community have had right at 3,000 cases and a devastating over 50 deaths that have been associated with COVID-19 in Liberty County. And so as we reflect back, we understand the urgency and, the impatience of our citizenry in Liberty County so far as getting out and doing things, trying to get back to some sense of normalcy. We are just not there yet. We're going to encourage you to please be even more patient with us because the fact of the matter is some of the numbers are going up. For example, the Community Transmission Index is an indicator of how we are spreading the virus and how widespread the virus is in Liberty County or in the community. And basically, just to give you a sense of where we're at and how we got there and where we're going, we started out obviously at 0. We peaked at 560. Then we went down in February 17, 18 time frame, down to 190. And so we were very excited last month, very, very excited because we were headed on a downward trend and we were going rapidly. However, over the last 30 days, we have had some fluctuation, but we stand right at 350 now. And so the threshold is 100 for a mask mandate. And so you could see that we are currently at 3.5 times what that threshold is. And so we definitely don't want to add to those numbers of deaths. The cases are fluctuating as well, but they're still going up. So what does that mean for our community? So far as the city of Hinesville operations is concerned, we're going to continue to adhere to social distancing guidelines and CDC's guidelines. We ask that you have been very cooperative in that way, and we appreciate that. The events is a major concern for certain businesses and organizations in the community, and I get it, trust me. I would love nothing better to have events all around Hinesville every day for that matter, but we're just not there yet, okay? So we're scrutinizing the numbers and we're scrutinizing events. As we get closer to the opportunity to allow these events, there will still be scrutiny in place, but please understand that it's not personal. We are not basically selectively allowing certain things to happen, whereas others are not. We are just trying to be consistent as possible with what we are requiring, and that is we're trying to keep the entire community as safe as possible. So we encourage you to continue to work with the city of Hinesville. All of our facilities are basically armed with masks so that you come inside, you can get a mask, you can wear a mask. We're still requiring the social distancing, and assembly permits are still prohibited. We have not approved those as of yet, although I'm looking at that on a weekly basis. Just so that you know, over the last week or so, the numbers haven't looked very good for us so far as the total community transmission index. Once again, we're 3.5 times. I can't overemphasize that. We're 3.5 times what we should be, where we should be, so far as those numbers are concerned. And so continue to work with us. Wash your hand, wear your mask, and watch your distance, as our illustrious mayors always say when they come before you. And I'm now going to yield to Mr. Joey Brown, County Administrator for Liberty County.
Thanks, Kenny, and I'll be real quick. Just as I guess to take off on what Kenny was saying too, it's kind of odd as we looked at the graphs and all over last night. Since we last met, we had a peak. I say a peak, but we shot up in a graph, and then we're starting to come back down. But on most cases, and he mentioned the Community Transmission Index, one indicator, all the indicators are up from where they were 2 weeks ago. Sometimes that doesn't make sense, but is still present here. And so I agree, 100% with what Mr. Howard told you there. There have been, as of yesterday, a little over 10,000 vaccines, almost 10.5, that have been administered. The mayor mentioned the schools having some vaccines are opening up. They actually had a mass clinic for the Board of Education, 365 teachers, the ones that chose to, had that done, and they're due to get their second dose on April the 10th. So that's progressing nice. The mayor also mentioned the expansion, so I won't talk about that. Testing still occurs in Brunswick and Chatham, as well as Diversity, and over at Liberty Regional Medical Center. Vaccinations, as he mentioned, expanded to those over 55 with certain conditions. Same folks are still running some of those tests for you, or giving out the vaccinations, Remember to go to the DPH website. There's a listing of statewide businesses that's expanded to: Kroger, Walmart, various pharmacies. So don't just think you're locked into one place. But here's what I will ask you to do, please, for the sake of saving that vaccine. If you schedule with one place and you're in a 2-vaccine slot like the Moderna or the Pfizer, and you decide to schedule your second shot or even your first shot somewhere else, call and let those folks know ahead of time so that vaccine won't get wasted. There's a lot of cases at the end of the day that they're trying to fill slots because they have vials already open. And so that's one thing that's very important. The other side of that is on their website, on their DPH website, there is a place that you can get in line for late daily doses. Again, if you want to try to do that, go ahead on, sign up, because at the end of the day, inevitably, unfortunately, there are some vials that are already open that will have to be disposed of, and you just need to be prepared to drop and run quickly to get those done. Again, watch the COVID-19 Georgia CHD.org website for updates and all of those stats. Our general offices remain about the same. We're screening folks coming into the building. In fact, just installed some stuff I know the city's had, and kudos to them because it works very, very well, and that's the thermal imaging thermometers at the doors, and those give a much more accurate reading on what's coming in. Again, I think all of our goals there as local entities is to protect you and to protect our workers and to be able to here to do the job for you. Court facilities, there's been a change. So we talked so long about non-jury trials. Those have now been authorized by the Chief Justice as long as they pertain to guidelines that were established in the Atlantic Judicial Circuit. Those are specific to each county. That's going to start unfolding. Just remember, we've got a year's worth of jury trials that have got to try to be caught back up. So that will be a very, very busy place under strict guidelines that's going to occur there. Recreation, we did start the spring sports schedules. We were down there the other day. There's a large number of folks moving around there in the soccer, softball, t-ball, baseball type realm. Very, very, very good to walk out of that building and see all of that activity, and that's the positive side. The negative side is we got to remember to distance if you're not with your family. So enjoy the outdoors, enjoy the good weather, enjoy seeing the participation that's occurring there. But we are following, just know that the coaches and staff are following very strict protocols there. We have had some instances where some folks on some teams have gained exposure, not from inside of our programs, but from outside. And so we have some policies in place there about temporary stopping practices for that team and their interactions for 7 to 10 days until we get past that period to ensure everybody's okay. And everybody has been. But again, just bear with us. It is good that they're finally be able to try to return to some normalcy. Our board meetings, nothing has really changed right now. We're still practicing limited attendance with those only on the agendas, and we're only handling business items that are necessary at this time. I do encourage the businesses and the persons to keep on doing what these gentlemen have told you to, and that is to distance. And so now let me go to a personal thing, and it's about the shots. So I've had both. Being on the emergency support function list here at the county, was able to get both. Some hesitation, even about the first one as I go in there, and that's all over the board. And I thought, well, I'm going to get this thing because I really don't want to die from COVID when there's an option there that has been allowed for us to have. I ran into a person and in some of my hesitation time was saying, "Are you going to get it?" And I knew I needed it for work. I knew I needed it for the other reason. And they said, "I'm going to get it, not for me, but for others, because there's no guarantee that I won't get it if I don't get the shot. And I don't think I could make it if I knew I exposed somebody and harmed them or watched them pass." Now, that's pretty extreme, but just harm them. And then I was sure I was going to get that shot. So I would encourage you, do your research, talk to your physicians, talk to others, but in the end, it's not all about you. In the end, it's about others, just like the masking is. So I would encourage you to think about that. And if you have the opportunity, as my doctor told me, which one should you get? He said the first one you can, that's what you should do, to go ahead and book those shots. So again, thank you so much for joining us. Thank you so much for watching in. You are our news source. You are the ability for us to transmit information to you to get out to others. This is why it's so important. So encourage others to watch. I will tell you before we leave is that we have had some discussion about the dissemination of information to you. Our websites are running wide open at the cities and the county, Facebook, and other social media means. Stay tuned to these sites over the next couple of weeks. I know we've been trying to come to you about every 2 weeks. You may see us start to space that out a little more, not because we don't want to come to you, but because we want to have that wealth of information to give to you in person if necessary. And we're working on several things now as we move forward. So just stay tuned. Thank you for what you do out there in the community. Please stay safe because we love you. And until we see you again, God bless.